With this session update, I'm Shannon Lurkey. Governor Walz signed into law a bill that will provide $21 million to fund public health efforts in response to the COVID-19 virus. Here's that event.
Good morning, everyone. Thank you for joining us. I'm proud to be here to be able to sign the first bill of this session. More importantly, I'm just proud of the bipartisan work and the leadership shown by the folks who are here with me. The safety and security of Minnesota citizens is a top priority in this building and in Minnesota government. There's absolutely no daylight between us around those responsibilities. I'd like to give a special thank you to Commissioner of Health Jan Malcolm for her professionalism, for her ability to help guide and lead us through this time. Thank yous to Speaker Hortman, Leader Winkler, Leader Doubt for moving this piece of legislation, and then in the Senate to Senator Gazelka and the folks who are really kind of doing the work of putting this thing together, Senator Ralph, Senator Benson, and Representative Liebling. We're grateful. This allows for funds to go directly to Minnesota Department of Health, doing everything we can to make sure that we're following the protocols to contain spread of COVID-19, with the assumption that there will more than likely and probably be more cases start to come up very quickly. This has been the pattern elsewhere, but having the resources necessary to mitigate that, to get folks the treatment they need, to get folks self-quarantined is the right thing to do, and to show that we can come together in an incredibly fast bipartisan manner to make sure that those resources available is just something I'm really proud of and thankful for the folks who are here. With that, Commissioner Malcolm.
Thank you, Governor Walz, and I just would like to also echo our deep thanks to the members of the legislature who did this work in such a rapid fashion, really truly unprecedented. I think it was about 2 weeks ago right now that I gave a briefing to the legislative leaders, the governor, lieutenant governor, and we began talking about the need to approach this issue from a science-based perspective, in a very calm way, in a prepared way, so that we are ahead of the curve of what we, as the governor has indicated, what we expect to see. We've, as you know, been ramping up testing in our laboratory, testing more and more submitted samples each day. As we expand the testing, we frankly do expect to find more cases. And as we've seen in other communities, while all of the Minnesota cases so far have had a known source of exposure, it is quite likely that we will see community spread in Minnesota at some point. So these resources are so essential to get out to local public health, the healthcare coalitions around the state, and the epidemiologists, research scientists, and laboratorians at the State Department of Health who are really going to be on the front lines of helping to identify the patterns and to work with us on not only individual and close contact containment strategies, but community strategies as well. It is so important. We do have tools, and this bill gives us some of the tools to help to manage the evolution of this epidemic in Minnesota. But our success in slowing down the spread of coronavirus in Minnesota still does remain a matter of individual behavior. It's so very important that people stay home when they're sick. That is the single biggest thing we can do to help manage and slow down the spread of this disease in Minnesota. But we are very grateful for the speed with which these resources have been made available to us and the flexibility that the legislation gives us to direct the resources to the public health response. So thank you so much. With that, Lieutenant Governor.
Thank you, Commissioner.
Thank you, Commissioner and Governor. I think we all know that this is a day that we can be proud with bipartisan support, folks coming together for real solutions, and just a commitment to make sure that we're doing everything that we can to try to mitigate the spread of COVID-19. And it's important that as Minnesotans, as the Commissioner mentioned, individually we are responsible for caring for our fellow Minnesotans. So the ways that we can do that: stay home if you're sick, wash your hands. And we can't reiterate that enough. My daughter sings happy birthday twice as she washes her hands as the way to make sure that she's doing it for the full 20 seconds. We encourage Minnesotans to do the same. And then finally, you can stay informed through the Minnesota Department of Health's website. And remember that in Minnesota, that elbow bumping is the new way to greet one another, and that we want to try to ave shaking hands and then touching your face. These are all simple things that we can do to protect each other during this time. So thank you for everyone who has been, who's just really stepped up and taken this very seriously, moved quickly. We're grateful for our legislative partners for getting this done. And with that, I would introduce Speaker Hortman. Well, good morning. I want to thank the governor, the commissioner of the Minnesota Department of Health, and the Minnesota Senate, but a special thank you to Minority Leader Doubt for working with us yesterday and making sure that we could get this legislation through to the governor's desk as soon as possible. Really unusual to see a totally unanimous vote in the Minnesota House of Representatives, and we had every single member voting for the legislation. That should give Minnesotans confidence that their government is ready to work together, to bond together, to do the things that need to be done to protect the public health. And I won't reiterate all the tips that Lieutenant Governor Flanagan gave, but there are things within our own control that each of us can do, whether it's due to cold and flu season or COVID-19, to make sure that we're doing all we can to arrest the spread of germs to the extent we can. We will be looking at more legislation. We'll be looking at expanding the governor's peacetime executive authority. We'll be looking at a revolving loan fund that may be necessary for our healthcare providers, and also looking at some economic assistance to folks who really should stay home but don't have a paycheck if they choose to make that responsible decision to stay home. So there is more legislation to be considered related to this outbreak. But hopefully you can count on this legislature to continue to work in a bipartisan manner for Minnesotans. And with that, I introduce the Senate Majority Leader.
Well, what you can see is that the governor, when he reached out to the Senate and the House, Republicans and Democrats, we said a few days ago that we would take action, and that action was taking place yesterday. That we move forward, and it's actually fairly complicated to move that quickly and actually agree on something, but that's how important this is. But I want to remind people that we shouldn't fear this. We should look at the science behind the decisions we make and move forward. And like the leaders of old, I want to just remind the public to stay calm and carry on. That was a message during the World War II era, but we can do that with this. We can listen to the advice of science and CDC and make our decisions, but just know that we are unified in Minnesota. The governor, the House, the Senate, Republicans and Democrats will do what we need to do, but keep calm and carry on.
Very good.
And with that, I have Senator Kemp.
Thank you, Paul.
Thank you, Senator Gazelka. I also just want to echo my appreciation to the governor and to the commissioner and everyone who's working so hard at the Department of Health in such a professional and evidence-based way to make sure that we are keeping the people of Minnesota safe and healthy. This has been a really excellent example of what we can do when we work together and we focus on the people of Minnesota. It was truly bipartisan, it was unanimous in both bodies, and that is something to recognize. I also just want to echo everyone taking personal responsibility to do what we can to arrest the spread. And for those who may think that it's not a big deal for them, and that very well may be the case, we need to remember that there are vulnerable people in our communities, and it's our responsibility to be careful for our neighbors, because we know that's what matters to Minnesotans. So thank you very much. And Representative Doubt.
Thank you all for being here this morning, and thank you particularly to the governor and to the administration for the great communication with the legislature on what the status is of the preparedness. I think there's confidence in the legislature, and I think the unanimous vote in the House and the Senate show the confidence that we have in the fact that the state is prepared. So Minnesotans should feel good about that. Yesterday when we got to the House floor, there was the language wasn't quite right, so we left a quorum call open for a little bit while we worked out those differences, and I was glad to be able to help negotiate that out. But everybody deserves the credit for coming together and doing this so quickly, and I think it puts our state in a really great position to be prepared for this. So thank you to everybody for being here.
Thank you, Leader. This time we'll sign it, then we'll be glad to take some questions.
Nobody wants to get close to anybody.
We'll be using one pen and not handing it around. When we work together, we make a difference for Minnesota. Thank you all for making that happen. The money's moved, and now we can get to work. So thank you all. We'll be glad to answer any questions. Our Leader Doubt will be glad to answer any questions.
Commissioner Malcolm, is there anything new in terms of the number of tests, anything new you can report on that front? And are there more test kits coming to Minnesota?
We have received additional test kits even this week. We have, we think, good capacity right now to test the volume of inquiries that we're receiving. We do expect more tests to be coming online through commercial labs. The Mayo Clinic is about to begin being able to test as well. So we're in close communication about how to coordinate the testing, the increased testing capability that we'll be seeing in the coming days. But for now, all of the tests are going through the laboratory. The lab staff are working very hard, doing multiple runs per day so that we can turn results around on a same-day basis. So we are able to do that.
I'm sorry, quick follow-up. Do you know the number of tests that you received that the Public Health Department has? And then also, in this $21 million, is there any breakdown on how that's going to be spent, or is that going to be on a day-by-day basis?
We're over, well over 100 patients who have multiple samples each tested in the lab as of this point, and it is ramping up day by day. The total number of test capability that we have is over 1,500 at this point. So we anticipate being able to keep up with the demand, at least for the near term, but we have more test kits on order, and as I mentioned, the community capacity for testing will be expanding. In terms of how the resources will be deployed, as I mentioned, we really appreciate the flexibility, having the legislature having had the foresight a few years ago to create this public health emergency contingency fund, gave us the vehicle to receive the money. We gave the legislature our best estimate of what the public health component of the response would need for the next year. So it was a $25 million figure. And we came to that estimate by estimating the number of hours of MDH staff that will need to be taken off of other work and devoted to this COVID response, a lot of epidemiology and laboratory and time, the folks who do the disease investigations, the contact tracing, and so forth. A significant amount going out to local public health to beef up their capabilities, as well as some funding to the 8 regional healthcare coalitions around the state, which are really our kind of on-the-ground coordinating vehicle to coordinate with the healthcare system in terms of tracking where resources are, how we're doing in terms of being able to meet patient care needs. So those are some of the examples, but the legislation gives us the flexibility to direct that money where it is most needed.
Do we know yet how much we're getting from the federal government?
We have seen, we have heard estimates from some of our congressional delegation, and there are many different streams. There's a plan to beef up the strategic national stockpile, which is where a lot of the personal protective equipment is, and so that's outside of any dollars that will come to Minnesota. We'll have access.
$3 billion that was passed recently.
Yes.
Two senators also said it was about $10 million, but we haven't gotten any confirmation of that.
That's correct, and that $10 million comes from a particular grant fund that the feds have given to the states, and they've told us to estimate that through that one grant fund, we'll get about 90% of what we got last year added for COVID-19. So that's where the $10 million comes from. But in addition to that, there are other parts of the bill that appear to target healthcare providers, as well as this very important strategic national stockpile conversation, as we're all talking about the availability of personal protective equipment for healthcare workers and public health workers. That's going to be critical. So we're very eager to get more details on how that strategic national stockpile is going to work and what other funding other than this one grant that they've been able to quantify for us. So hopefully within the next few days we'll have a better sense of that federal resource.
Commissioner, you've been around for some time. You've served through several governors, been in the public-private sector. Have you ever seen anything like this?
Well, again, the speed with which the legislature came together to work with us is unprecedented in my memory, and certainly seeing those unanimous votes yesterday was not only important to us, but I think important to the citizens to see that this is how government can work, and to really put aside any differences of opinion and be really guided by the facts and the best thinking that we can do. I think it's a testament to the confidence that the legislature has in the public health system and in the healthcare system in Minnesota. And we now need to deliver by continuing to work in close collaboration across the entire health continuum to put these resources to work. And as Speaker Hortman said, this is the first step in what, and there will be more steps in terms of quantifying what the needs are in the healthcare system and some of the economic effects on vulnerable Minnesotans.
Commissioner, can you give us some perspective on this? And Senator Gazalka alluded to this. The sentiment, Senator, was, look, we need to be cautious, but let's not panic. Stay calm, carry on. How does this coronavirus or COVID-19 compare, and how cautious should Minnesotans be? Should they stay at home? Do we need to do the elbow bumping religiously? I mean, give folks an idea, or don't we really know how serious this is yet?
I think part of the challenge is this is such a rapidly evolving situation around the world. We've not seen something spread this quickly. Really, it's unprecedented in modern times. And the information on the virus, how it is spread, how dangerous it is, for whom, is still rapidly evolving. We do know, just from a numbers standpoint, how this compares to the seasonal flu. And we keep reminding people that the very same ways we can protect ourselves against flu and colds is the same basic personal measures we need to take to protect ourselves against COVID-19. And we have, as you probably know, in Minnesota had over 6,000 hospitalizations and unfortunately approaching 90, I believe, deaths in Minnesota this flu season from the flu. So just putting it in context. But we're learning more and more all the time, literally daily, about how COVID compares in terms of its ease of spread and severity to the flu and other coronaviruses with which we're more familiar. So I don't think the cautions are overblown in any way. I think it's just extremely prudent for us all to do what we can do to keep ourselves healthy. As the Lieutenant Governor said, it's not only our own health, it's what we individually can do to help mitigate and stop community spread. That is the real message here.
Commissioner, a lot of people are watching the movie Contagion. That your department is portrayed in that movie. I wonder, have you seen it, and what's your advice to people watching it in terms of what to take away as Hollywood and what to take away as a learning experience?
I'll have to confess I haven't seen it. I guess I'd better do that. So I think our epidemiologists at the health department have a deserved strong reputation for the thoroughness of our approach to epidemiologic investigations. Certainly everybody, I think we need to be very careful and really rely on our community partners to help get evolving information out, guidance on how to protect ourselves, guidance on what employers can do, guidance on how healthcare providers can best protect their workforce, because these messages are getting informed day by day, week by week by the emerging data coming out of other countries around the world and here in the U.S.
How would you compare this to the swine flu pandemic, which had a slower ramp up but wound up killing almost 12,000 people in the United States?
Well, I think, again, in terms of the ease of spread and the severity of the illnesses caused, that information is still emerging. We've seen estimates before of how the severity of this disease compares to others, and those estimates change as more data comes in from other countries. So I'm a little hesitant to rank it, but I think the H1N1 experience is instructive for our planning, how we approached that, how we got through that in terms of coordinating resources across the healthcare system.
Say more about that. I mean, how do you compare that, the response to that, to this, and what lessons did you learn that you can now apply here, perhaps more rapidly?
Well, I think that was a great example of the community having to confront a novel virus. Now, it was a flu virus, so some of what we don't have here, we had for H1N1. It was a novel virus, so we didn't know, just like we don't know now. But we had some antivirals that were helpful for treating people, which is not the case with COVID. And but similarly, there was no vaccine for H1N1 at the time, just as there is not now. So we really needed to rely on those basic public health interventions. And we also really were able to work with the healthcare system to coordinate real-time sharing of information about capacity and where resources needed to be moved around the system. That has served us well. I'll remind you, we also had a particularly virulent flu season just in 2017 and 18. And that was another recent example of really needing to work and think as a system about how to coordinate our response.
For the governor and the leaders, could you talk a little bit more about what kind of economic assistance for workers might be on the table? The president has recommended payroll cuts or assistance for hourly workers.
We're really at the very front end of taking a look at that issue. I think, you know, as the Speaker of the House, it's my prerogative to make sure that we take a look at what we can do to help the public health of Minnesota. And right now, we know that there are workers who, if they are told to take time off by their boss, that they have some kind of symptoms, and if they miss work, that they don't have pay. And we know that that will have an impact on people's decision of whether or not to take time off. So I think we need to look at what's happening at other jurisdictions around this country and around the world to make sure that we put whatever economic tools there are in place to make sure we're protecting the public health, and that includes helping the private sector.
What do you think about this? Sorry,
So the Speaker and I, in fact, had a conversation this morning, and then the Speaker and I and the Governor and the two minority leaders also, and there's multiple areas that we're talking about. If you just think about the flu, though, right now, frankly, if somebody was out for 2 weeks, most employers provide sick pay, and it could be covered under that. Is this different, is what we need to talk about, if they're quarantined for 2 weeks, you know, and so that's why the issue is being raised. But the fact that we passed this first bill so soon is actually pretty remarkable. Now we have to just step back and let's look at the facts and see where we're going, and time will tell.
Senator Gazalka, are you as feeling as cooperative toward the proposals on empowering the governor to declare emergencies in public health situations as you work with this funding?
Again, the governor and his team have asked for some things that they want us to consider. And just to be, both myself and the Speaker and the two minority leaders, I would want the four of us to talk about what are the powers that the governor might need here that in the past did not seem necessary. That will be a decision of the four leaders working together. That is an issue between the executive branch and the legislative branch, but we'll figure it out. The point is, if there's something that's necessary, we'll work through to a solution.
Commissioner Malcolm only has time for one more question. She has to take off.
Commissioner Malcolm, quick question. To what extent do you expect the county public health departments that are going to be looking for assistance or supplies or other things?
That a piece of the estimate that we gave to the legislature, and let me just say too, this was our estimate for a 1 year's worth of effort from this point in time till next February. So this is not our forecast of all of the needs for all of the system for the duration of the epidemic. But a very critical part of that was getting resources out to local public health. And in our estimation, we used a formula based on size of the community health board and how many staff might be indicated. But we will give the locals the flexibility, whether they need to spend it on added staff or communication or what will best fit their local situation. I do have to run. We're having the very first meeting of an informal ad hoc advisory group reaching out to community leaders from multiple sectors to try to coordinate our education to the public and to make sure that we're getting really thorough perspectives on the impact of this epidemic on Minnesotans. So I need to run off to do that. Thank you.
Quick one that's very important. There's a lot of mass gatherings taking place, wild games, high school tournaments coming up. Some conferences in college have canceled tournaments. Are you getting guidance from the CDC, and where does the state stand on that right now?
Thank you. That is a very good question. Certainly, limiting mass gatherings is important once you have confirmed community spread of a certain size. We are not there in Minnesota, so we've not yet been advocating cancellation of large gatherings. We are working with folks. having folks know that's a possibility in the future. But based on our situation today, we have not made recommendations for canceling large gatherings.
So the governor can stick around for a few more minutes here. I do know Commissioner Malcolm and our legislative leaders have other obligations, so I'm going to let folks off the side here, and then Governor.
We'll let them go. I'll take some off topic, but I would follow up on Dave's question. I think it was an important one about these added powers to the executive branch. I just want to be very clear on this, that I too, not just those 4 leaders, encourage them to be very judicious. This balance of power between the legislative branch and the executive branch, I think all of us don't have to look too far to see what can happen if we start to get a little bit out of balance, and I encourage them to think about it. We will not ask for things that aren't necessary, and I think we'll try and find ways that they feel comfortable, whether it's through sunsets or some of that capacity. But I think the trust that gets built up here has them considering the ability to do some of that. And I think you heard the Leader Gazelka mention, we haven't had to do this in the past. One of the things I keep mentioning to people is you see states like New York or California or Washington State declaring states of emergency. Some of that is dependent on their legislative and their statutory authority that governors need to do that release funding. We don't need to do that here. And our Chapter 10 disaster authority extends to natural disasters. It will cover, it can cover, but I think we're talking about some of the clarifying work. But I do want to be clear, we're in direct cooperation from them, and I would encourage them to be very judicious about giving away power, even setting in the legislative branch of someone who's deeply concerned when we get these branches out of balance. I think we're very close. I think these are just a few tweaks. And with that,
Governor, you're 2 days away from releasing your supplemental budget. What else will you put in there for response to this? And how much risk buffering are you doing given the unsettled nature of the economy?
Yeah, we will be releasing it, but I don't think it's any secret to anybody here who's been covering this. The Lieutenant Governor and I and our administration have been talking hard about being conservative and responsible about this. My first response, and this was months ago before COVID-19 was on the scene, but with a belief that there were yellow flashing lights on an economy that's the largest growth, that was well before, and this is put together well before the last couple days on Wall Street, paying back that 491, being thoughtful about an opportunity to do our capital investments on our local jobs and projects bill, and then having a very narrow focus on emergency situations and contingencies of things that need to happen now. I think it would be a mistake to not leave significant resources in reserves and on the bottom line until we understand exactly where this is going to go or exactly what happens with the economy. So I think you can expect to see a budget, maybe unlike one you've seen, that'll fit easily on a page, because it's going to be focused around those issues of those emergency and pressing needs that we've talked about.
How important is it for the folks who don't have, in your mind, the folks who don't have sick leave, sick time? Does the state need to step in for those?
Well, I think it's a good conversation, and I want to keep it in this space we had here. They were very focused, and I think some of the negotiations, and I do too thank all the leaders and Leader Dowd, where we narrowed this so that everybody could do this to send a strong message. There's other issues that are going to be a little more, I wouldn't say controversial. They'll have political differences in this. I think the interesting thing around paid sick time is that President Trump is talking about it today. So this is not confined to a Democratic proposal. We have certainly, and Lieutenant Governor has advocated for many years, safe sick time, paid family leave. Those are things that we obviously put in our budget last time to get done. I think it is worth talking about that in the context of COVID and getting people out, but in a broader context of the economy in general. We see where this happens. This is not good, and in a health emergency, asking someone to worry about paying rent or child care or leaving work and keeping folks safe, that's a tough one. So I think we need to have the conversation.
Would you be okay if it were just for COVID? Because some folks will argue, well, this is the camel's nose.
Well, I'll wait and see. Yeah, they may, but I think the camel needs to get under that tent, because countries that do it have stronger economies and it works better for people. I've obviously advocated for this. I know there's a disagreement about it. The problem I have is that large employers already offer it. It puts a disadvantage on smaller employers and folks who can't get there. So I think it's worth having, and I think during this time, we certainly can manage this situation and talk about statutory changes and do a local jobs and project bonding bill. So.
Governor, thoughts on the gun safety hearing that's going to occur today? The Democrats are about to have a press conference about the bills that they want. What do you want to see come out of the session? I never heard.
Well, I'd like us to make sure that Minnesotans know that through data and policies that have worked in other states, we can reduce gun violence and gun deaths. I think that these are things that, again, I say, were non-controversial in Republican-led states of Arizona and Florida. The data supports, especially the red flag laws. There is judicial review and due process for folks. But in many cases, I hear the stories, again, of a family where their father, through mental health issues in that case, it could be numerous things, ended up killing their mother and themselves. The family had been trying for 6 months to get the guns out of his hands, and they are convinced had we had red flag laws, it might work. So my hope is we can do some of those things, that we can break some of the logjam. I do think it bodes well in Minnesota that we are still trying to, and still functioning very bipartisanly. I know this is a very, very divisive issue for folks, but there are some real solutions that are facts-based, and Minnesotans have spoken pretty loudly that they agree with this.
Several teachers went on strike this morning.
Okay, Esme, Dave.
Esme, Dave. I'll come back.
And Theo.
I got these three.
Can I just ask you about the St. Paul teacher strike, both from your perspective as governor of the state of Minnesota and also as a resident of St. Paul and the father of a student?
Yeah, father of a 7th grader in St. Paul Public Schools. First of all, my son receives a quality education. I'm grateful for the work that's done, both those teachers in the classroom, the support staff, and the administrators. I'm deeply involved in this. I encourage folks to continue to negotiate in good faith, get back in there to make sure that we have the resources necessary, the teachers necessary, and the budget necessary to deliver that world-class education. So I'm encouraging them to continue to get there and to get that done, but this is a process that you don't want to have to get to this point, but this is still part of the process, and I'm hopeful we can work out a deal.
Dave, Theo, we're getting a little tight on time.
Yep.
Same thing, but who's right? Who's wrong in this strike right now?
Well, I think in many cases that's not the answer that's ever there. Any of those you've negotiated, it's coming to the middle ground. It's finding a place. Here's what I do know is whether you're on the administration side of this or you're on the teacher side of this, the focus is on making sure our children get the best education. I think one of the things you see is that I have talked a lot about this. We heard a lot about it. Lieutenant Governor, of course, spent a lifetime working on this. Our students are telling us there's not enough support on mental health issues, and that teachers are left in classrooms where this is becoming an issue that is very difficult to deal with. So, and then I've been there too as a negotiator, and then on the school finance side of seeing where they're at. It's one of the reasons that I think we have been talking about. We need to have a restructuring holistically to kind of go Minnesota Miracle 2.0 about how we fund schools and how we get these things right. So those teachers are out there today asking to make sure that they have the resources necessary to provide for mental health, provide for the safe well-being of those students in the classroom. And the district is out there arguing and saying we don't have the resources to do that. So our administration, through the Bureau of Mediation Services, Jan Johnson, the commissioner over there, she's got 40 years of experience with this. She'll be in there trying to mediate. When folks are ready to get back to this, to negotiate in good faith, we'll be there, stand ready to help. So Theo?
Thank you. Oh, one more question on coronavirus.
Sure.
Because yesterday the speaker said she would support limiting access to the Capitol if the health department recommends it. What's your threshold? Because we've got 1,000 people in the rotunda.
That's right. No, it's a great question. In fact, just before we came up here, we just had a pretty extensive meeting on continuity of operations plans. Myron Franz, Commissioner Franz from MMB is down there, of us to have those contingencies in place. We have these plans. It's getting them out and dusting them out over the last few weeks of what it would look like. How would we operate remotely? Statutorily, we can't vote electronically remotely. What would need to be changed so that we could do that? The U.S. Capitol did a lot of work on this after 9/11, and of course, those of you who have been out there, that entire visitor center is behind those steel plates where if something happens, they go in there, seal the Congress in, and there's a continuity of service. We're talking about that. We're thinking that through. We're going to, again, like so many of these, go on the health departments and the experts' advice, as you heard this, and I think Tom asked the question, and it's one I've been asking. We got NCAA wrestling, we got other things happening. How are those decisions going to be made? That's when we're at community mitigation stage, and we need to make those. The same thing will be true of this location, but we have got to have continuity of services. We have got to protect the democracy to make sure that we keep going, and that's the things that I'm simultaneously talking to them about, not just inherently giving us more power so if they can't come to the Capitol, we can make the decisions. That's not what it's about. It's making sure that what that remote legislature would look like should that happen. And I just think it's just incumbent upon us to plan for that worst case scenario and certainly do everything we can to try and prevent that and make sure that it doesn't happen. But if it would, the state would continue to function.
You're the head of a 30,000 some employee enterprise, executive branch. What extra accommodations are you considering for your workforce?
That's a great question. Just in the enterprise of state government, that is exactly what Commissioner Franz has been working with folks about. How are we going to handle added sick time? How are we going to handle employees who don't have any left and are quarantined for 14 days? That's what the discussion this week was on. We went to the legislature this morning because we're going to start trying to finalize that and put that out. And so we're asking each agency to determine how their functioning would be. Looking at IT, do we have the capacity to remotely function? Do we have enough laptops to even do that? Do we have the ability to safe and secure connections if we're asking revenue folks who are processing right now, getting close to peak tax return time? How are we going to be able to process those in a safe and secure manner? So that's being developed as we speak, and it's something that, again, Minnesotans need to know. All of those small details are being worked out so that the smallest disruptions to their life are what we're hoping for, making sure that we continue on business, as you heard people say, business as usual, but also recognizing that we're in a unique space.
All right.
So thank you all.
Folks, we'll leave this on the table if anyone needs a photograph of it.